by working directly with Pharma, we've been able to increase the awareness of patient needs that are not simply limited to what the FDA requires to put on the side of a pill bottle or an injection box. Patient needs are quite varied, and what we try to focus on is not the medical treatment diagnosis, long-term survival, but rather the emotional surviving day-to-day aspects of the disease. Instead of trying to focus on getting a patient to 30 years, we're trying to help that patient get through to tomorrow morning. And while Pharma is very busy working on some great medications and some great cures to help patients, I think sometimes even the most well-meaning scientists can lose sight of the most immediate needs of the patient, and that is simply trying to survive day to day. And I think we've been very instrumental in communicating that need to Pharma. It's actually quite humorous. There have been numerous times where I've talked to my physician who is really on the cutting edge of acromegaly treatment, and I've told my doctor, hey, there's a new drug that's being worked on from XYZ company, and my doctor will say, really, I didn't know about that one, you gotta let me know. And that's always kind of a kick to me. I'm very lucky in that the pharmaceutical companies do see value in working with acromegaly community. And because of that, because I have their trust, and because I feel and they feel that I've earned that trust, they do come to me and they say, hey, we have a new drug we're working on, or we have a few questions for patients with the disease. We would like to talk to them. Can you help us? And so long as their cause is legitimate and they promise to play by our rules, and our rules are very simple in that we require that patients are allowed to opt into a survey, not that they can just pick up the phone. Hi, this is Joe from Y Survey Company, and we're doing a survey on acromegaly. Come talk to us. We'll send you a check for $100. I will not violate a patient's trust. I will not violate medical's trust. I will not violate pharma's trust. And as long as you have that faith from all three branches, the services that I've been able to provide for everyone as a whole have been astronomical. And because of that, we've really been able to affect serious change in people's lives. We would love to see Pharma help spread the word about acromegaly to doctors. Make sure that not only general practitioners are educated as to the disease and its effects, but we need other practitioners of medicine to understand their role in diagnosis. We've had patients who've been diagnosed by their dentist. We've had patients diagnosed by their eye doctors. We've had patients that haven't been diagnosed for years on end. The average patient of acromegaly will wait about 10 years between the onset of symptoms and actual physical diagnosis. Now, part of it is because this is such a complicated disease. And I understand that, and I understand how difficult it is to pinpoint. However, if there were more non-endocrinologists who were aware of the disease, its effects, and its impacts on people's lives, I do believe that we could cut down diagnosis lapse in years. And the sooner someone gets diagnosed, the more likely they are to have a long and healthy life. Our primary concern is to get that patient that diagnosis. And I'll tell you what, the day the patient is told that they have a tumor in their head is probably the worst day of their lives. But at least from that point forward, we can treat them and move forward.